Esther McVey.
Pleasure to serve under your chairmanship today, Mr. Sharma. I'm also grateful for my honourable friend, the honourable member for Don Valley, for moving this motion. And I'd like to thank the 156,000 people who signed this petition, including 295 of my Tatton constituents, which helped secure this important debate today. Now, the vast majority of the nation has been busily moving on from the pandemic and the lockdowns, and rightly so. But much analysis of COVID and of those lockdowns is still ongoing, with the UK COVID inquiry beginning to hear evidence in June for its first investigation. And as co-chair of the APPG on pandemic response and recovery, I welcome that inquiry, as I do all other frank, open discussions and analysis on the impact and the effects of lockdown, and also how policies were originated and formulated. Our APPG has heard from renowned experts such as Professor Carl Hennigan, Lucy Easthope, Mark Woolhouse, Robert Dingwall, Dr. Alison Pollock, Lord Jonathan Sumption, Kate Nichols-Obier, and many more, who have all advocated for evidence-based, proportional measures to prevent avoidable suffering and loss. However, whilst all this analysis is still ongoing, the World Health Organisation is preparing an international treaty on pandemic prevention and preparedness. And it's this treaty that seeks to enhance international cooperation, which sounds good in theory, but critics say in practice it could transfer power away from sovereign and democratically elected nations and the rights of the individual into the hands of the WHO, an unelected and largely private-funded bureaucracy. And that is the nub of it. Who is having the oversight? Who is creating these powers? Who's going to have a say of it? And that is why people have written to their members of parliament to have a debate here today. They're saying, where are those powers going? Who is to remain sovereign? Who is going to have oversight? And so today, while we're here, it's to allay those concerns. It's to get those issues out in the open, and it's to head off any issues and to ensure that we are not signing away our sovereignty. And here's just a couple of the issues that constituents of mine have flagged up for the Minister to address. It is those word changes. It is not the countries would have to consider, it's now they will follow. It's not that it is non-binding, it is now that these things are binding. My constituents aren't some kind of conspiracy theorists. They come to me saying, you are my member of parliament. I want to hear you debate things on the floor of the House. I want you to be accountable, and if you're not, we'll vote you out at the next election. But we want to know that we are in control of what's going on, and that is why we're here today. They are concerned with those word changes, and what we're doing. I will indeed give way.
I thank my right honourable friend for giving way, and she's making a great and informed speech. Is she aware, and is the Chamber aware, that the WHO have extended the public health emergency of international concern every 6 months since January 2020? And regarding to the as far as the WHO are concerned, we're still in an emergency, and they will decide when that emergency is over, and they would return these powers to us once these treaties are in place.
I want to thank my honourable friend for putting that down and saying those words on the floor of the House today so they can be documented in Hansard. And these are other concerns that my constituents have. They remind me, not that I needed to be reminded, that it was the WHO that went against their own 2019 evidence-based pandemic influenza guidelines. It never advocated lockdowns as a method of controlling respiratory illnesses, but following China's early lead, it began to champion lockdowns. Just look at the U-turns on face coverings. In March 2020, they did not recommend them for healthy people, but the sudden change in their guidance that followed happened despite the apparent lack of any new high-quality research. It was BBC's Newsnight that suggested in July 2020 that the decision was as a direct result of political lobbying. Prior to COVID-19, the WHO had repeatedly overestimated deaths from new infection diseases and outbreaks. For example, in 2009, they predicted a swine flu death toll of 7.5 million and warned that nearly a third of the entire world population would become infected. This led to knee-jerk overinvestment in vaccine contracts, which clawed precious money away from fighting other diseases. In the end, it was concluded that the total global mortality was roughly on a par with annual deaths caused by seasonal influenza, nowhere near the original prediction. It is these issues, or it is those issues, that my constituents are raising with me. Just issues about who is it then we're handing over to control to. So they say, you know, WHO has not covered itself in glory on providing consistent, clear and scientific sound advice for managing many international disease outbreaks. And as we've heard from many people today, the World Health Organization was set up in the aftermath of World War II with the aim of providing a high standard of healthcare for all. They approached health in the round, promoting community-based services to address physical, mental and social well-being, all admirable reasons for why it's set up. However, in recent decades, their focus appears to have narrowed as private foundations and pharmaceutical companies become an increasingly significant and influential part of the WHO's funding base, and their approach has become more focused on vaccine-based interventions and, most recently, focused on blunt instruments like lockdowns, which, as I've said, we're still analysing the consequences of those. Safe to say, there was a negative impact on the young. As Ofsted's 2021 damning report pointed out, children had fallen well behind in their education and suffered significantly, particularly in mental health, as a result of that. And here in the UK, it's estimated that school closures will lead to significantly lower life expectancy and £40,000 being lost from their lifetime earnings for each individual. Children should never have had to shoulder such an enormous burden, one that will likely hamper them for the rest of their lives. And these lockdowns, these stay-at-home mandates, damaged the economy, but more importantly, it drove many people, and will do, into poverty, to such an extent that Professor Thomas of Bristol University thinks that 2.5 million life years have been lost because of a loss of GDP and because of those lockdowns. That is incredible, what we have put upon people, the poverty that we have inflicted on people with lockdowns. So this petition, calling for a referendum on the treaty, makes it clear there is growing concern about the expansion of powers of the WHO and the encroachment on national sovereignty. The UK government has declared unilaterally that the UK supports a new international legally binding instrument as part of a cooperative and comprehensive approach to pandemic prevention, preparedness and response. So can the Minister explain to me how this can be the case when Parliament has not yet been allowed to scrutinise those plans? While we must not overhype, I get that, the nature of the threat this proposed treaty should give us, or could give us, it must, however, make us all pause for thought. It may not yet be clear how the WHO would legally enforce any of these emergency powers and policies, but there is plenty of potential for their unelected bureaucrats to chip away at our democratic standards. It is vital, therefore, that we must demand robust debate and have an open review of all of these plans in Parliament and in public, something that was sorely lacking during COVID times. Our parliamentary system wasn't really designed to support referendums, so I would be loath to inflict another referendum on the public. However, I agree that it does need parliamentary scrutiny. We need debates. We need votes in both houses to ensure this country lives up to its democratic obligations to its citizens and to ensure we continue making our own decisions about how we manage public health threats in this country.
Mr. Chairman, it's a pleasure to follow my right honourable